with TDS. So these are the likely scenarios. Okay. If they've had a primary HSV infection at the onset of labor, you recommend cesarean section, and it should be ideally done within 4 hours of ruptured membranes. Okay. And if the membranes have ruptured, you have to give them IV acyclovir. If they've had recurrent infection at the time of labor, vaginal delivery is safe. If they had primary infection less than 28 weeks, so in first and second trimester, you have to treat that episode, and you could still consider vaginal delivery if it's more than 6 weeks. Okay. However, if it's within 6 weeks, you recommend cesarean section. Okay. So primary infection within 6 weeks, if they deliver, you have to go for cesarean section. If the primary infection happened more than 28 weeks, there's only one option. You only do cesarean section. And you continue antivirals until delivery, because you're going to treat the mother. You start with the treatment dose and you just carry on until delivery. Okay. If it's pre-prom, and if they have primary infection, you do an MDT discussion to plan the timing of delivery. And up until the mother is delivered, you give them IV acyclovir. So here is IV acyclovir, not oral one. However, if they have recurrent herpes and if they're less than 34 weeks, you manage them expectantly and you give them suppressive dose, which is oral dose. And if it's pre-prom with recurrent herpes more than 34 weeks, it says manage as per pre-prom guidelines, which is usually delivering them at 37 weeks. And you have to continue giving them the suppressive dose up until delivery. If the newborn is symptomatic, you give the newborn IV acyclovir. That's easy. However, if the mother had primary infection within 6 weeks of delivery, that's high-risk group, you investigate and treat the baby with IV acyclovir. If the mother had recurrent HSV at time of delivery, they are like a low-risk group. You observe the newborn and swabs at 24 hours. If the mother had infection more than 6 weeks ago, and if the baby was born within 37 weeks, and if the baby is fine, you observe. If the baby was born after 37 weeks, just routine